Hello and welcome to this webinar on labour and birth preparation. My name is Hazel Acland. I have been a mum for nearly 18 years and I've been supporting other people in labour and birth for 16 years. I trained as a doula 10 years ago now. I have written 2 books about birth and I am a member of Doula UK, which is a national UK organisation of about 700 doulas nationwide, and I also represent Doula UK in the European Doula Network, which is a group of doula organisations spread out across Europe. And I'm also co-director of the Nest Southwest. Really happy to be here. Next one. Okay, so use your brain. This is really important in labour and birth, but also tonight in this webinar. So I want you to think while we're going through this. Is this true for me? Is this right for my situation? Is this the truth? Disclaimer, I am not medically trained and what I'm telling you is not the one absolute truth. I am telling you things that I have picked up in my experience as a doula and as a birth supporter in the last 16 years. And these are ideas really that I'd like to share with you, but I'd like you to use your brain. And also to say before I go on that this is really a very brief introduction to the wonders of labour and birth. There's no way that I could cover everything that I would like to cover in just an hour. So this is a taster, this is some things to get your mind juices going and to do research and learn more about stuff in the future. And obviously, if you have any medical concerns, please talk with your midwife or your GP. So using your brain is also an acronym that we will talk about a bit later when we're looking at the birth process. And the letters stand for B is for benefits. So when you're looking at options for your birth choices, what is the benefit of this option? And R, what is the risks? Everything has a benefit, not a risk, a pro or a con, and you have to make up your own mind. I cannot make up your mind. Nobody can make up your mind for you. I am pro-informed choice, which means that I want you to be aware of as much as possible so that you have all of the information and you can make a choice that is best for you, your situation, and that you can be happy with it. So benefits, risks, A, alternatives. What are the alternatives to this decision? If I don't do this, what else can I do? And then you can make an informed choice from all of the things that are available to you. Intuition, what is your gut saying? What do you feel? And N, what happens if you do nothing? What happens if you wait for half an hour when you're in labour and you've been offered a choice? I'm just going to wait for 20 minutes, 10 minutes. See what happens. What happens if you do nothing? Is it an emergency? Does it have to be that moment? Can you just do nothing for a minute? So what can influence our birth experience? Okay, there's quite a lot of words on this screen, but I'm going to go around it quite slowly because before we get into things, I want to give you an overview, an umbrella view, let's say, of all of the different things that can influence your birth experience. I hope that you can see my little arrow down here, physical. So the physical influence, often when we're talking about birth, when people are talking about birth, this is often what is focused on. Physical and emotional, which is at the top. But I'd like to just stretch your awareness a bit this evening so that you think about some of the different influences of birth. So let's begin anyway with physical. So the anatomy, we're going to look at this in a little bit, don't worry too much. Pelvis shape, so there are 4 shapes of pelvis for women. And what shape you have will have an influence on your birth experience. It may have an influence on your birth experience. Hormones, which hormones are flowing in your body and in the people around you. OFP, that stands for optimal fetal positioning. So that's the position that your baby is in the womb. because that will influence which part of their body is presenting, and it'll affect the birth. Health and fitness of women and baby. So how healthy are you? And also remembering that baby is a whole person already, and they might come really fit and well and healthy, or they might have some health conditions which will impact stuff. And then moving over here to historical. How were you born? What was your birth experience, and what was the birth experience of your mom? A fascinating fact, which some of you might know, is that when a baby girl is born, she contains inside her ovaries all of the eggs that she's ever going to have in her lifetime. They're already there, ready-made. So when your mum was born, the egg that became you, if you were born in that way, was already there. So actually you came into existence inside the womb of your grandmother. Just going to give you a moment to take that in, because I think that's one of the most incredible facts. So it feels that on some level, some cellular basic level, energetical perhaps, you've been there for your mother's birth and for your birth. So does that encode into us? And then on another level, the family history of birth. How was it talked about in your family? What was the attitude towards birth and parenting and breasts and things like that? How did that influence you? And then the ancestral line, so things that have been lost. So we're not actually talking about them. We can't remember how great-great-granny was born, but somewhere that story was passed down. We might have lost the details of it, but does the story continue? How has that influenced you? Instinctive. So how the wisdom of your body to give birth. So childbirth, the fetus ejection reflex is involuntary. It's something that your body does. You don't actually have to think about it. And there have been cases of women in comas that have given birth. Not suggesting that, but that just as an illustration that your body has a wisdom and a knowledge to it that is just instinctive. And to remember here that we are mammals, like cats and dogs. They don't go to childbirth education classes. They are birthing in totally instinctively. So this is just a reminder that somewhere in us there is a knowledge of how to do this that is beyond mind knowing. But we do have minds and we do have questions, which is why we're here talking about this and looking at this wheel this evening. So the next section is emotional. How do you deal with stress? How do you deal with tension? How do you process things like that? What are your fears? Do you have any previous trauma? And how do you relax? We all have stress. We all have tension, we all have fears, but how do you process that? How do you deal with that? And how do you relax on a daily, weekly level? This will have an influence on the birth experience, and we'll come back to that shortly. Spiritual. For some people, they really get this, and some people it feels a little bit jarring. So some people mix up spirituality and religiousness, and they can be together, but not necessarily. So I've put in here rite of passage because there are two people here that are going to go through a rite of passage, at least two. The baby will be born. They will become into being. They will become alive, let's say. And the mother will become mother, whether it's your first child or your third. This is a rite of passage. Rite of passages are thresholds. They're doorways that once you go through them, you don't go back to how you were before. So it's like a one-way door. So once you've become a mother, you will always be a mother. You will always be postpartum. And the next section is location. So where were you going to give birth? What kind of birth environment is it going to be? What's going to be around you? Who is your team? Who's your birth partner? Who's your medical team? How do they work together? Some of these things we can choose, and some of them we can't choose so much. But it does have an influence on your birth experience. The next section is cultural and social. So here we are in Devon, in the southwest of England, in the year 2022. And there is a certain kind of birth culture and society that you're birthing into. You're birthing into the NHS post-pandemic. Let's say post. And maybe you have a certain section of society that you're a part of, certain expectations, but yeah, it's different from the historical and your own family history. It's society, so how things are at the moment, and that will influence. So giving birth in 2022 is a very different experience to giving birth in Devon in 1950, let's say. And the next section, we must not forget, is a section for the baby. So they are their whole person already. When they have been growing in the womb, they are themselves, and so they bring themselves, their personality, their bodies, their beings, their spirits, let's say, they bring that, and that has an influence on birth. And finally, this section, which I have left blank purposefully, because this is the mystery of birth. This is the unknowable, because however much we prepare, however much we read and research and practice, which I really do recommend, there is always an unknowingness of birth. We don't know what's going to happen. And there's not much in this world these days that we don't know about, that we can prepare for. So I'm bringing in that slice of unknowable. That's that. So before we go much further, I'm going to do a little basic anatomy lesson so that further on we know things that we're talking about when I refer to something. So play along with me. We're going to go around one by one. So this first line leads to this organ here, which is the placenta, which feeds the blood through from the maternal bloodline to the baby's blood. The next line leads to this big person in here. You can guess is the baby. That's right. The next line leads to this big bag that goes all the way around the baby, which is the uterus. The next line goes to this closed doorway between baby and the outside world. And that is the cervix. That is really important word, and so we'll be talking about that quite a bit later. The next line goes to this this sac here, which is between the baby's head and the pelvic bone, which is the bladder. So you can see why quite often in late pregnancy you need to wee a lot, because look, there's not a lot of space, that heavy head pressing down on it. The next line goes to this tube here, which has two names. It's called the vagina. It's also called the birth canal, which makes it sound absolutely massive, but it's not. It's the vagina. And before I go on to the next one, just have a notice of the angle that the baby has to go round. It's not a straight line. The baby cervix doesn't just open and the baby doesn't just plop out. Baby has to navigate around a corner there in between the pelvic bone and the spine. You see they go down and out and around. Okay, carrying on, next line is here. So this is another vessel, another organ at the back, and that's the anus, which is where your poo comes out. The next line goes to this pink band of muscles, which go underneath the baby and keep up all of your internal organs. And that's your pelvic floor muscles, really important, especially postnatally. Next line goes to this waters, which surround your baby. And that's the amniotic sac. And the next line goes to, you can't see it very well in this diagram, but it's a cord, and it takes blood from the placenta to the baby and then removes used blood from the baby and takes it back through to the placenta, and that's the umbilical cord. Okay, a couple more things on the anatomy. Oh, I clicked too fast. First one I wanted to talk about, ignore that muscles of the uterus one. First one I wanted to talk about is the pelvis. I couldn't quite get the right image to fit onto this physical anatomy image, but I love the image because of the way the baby curves. It really shows a good position baby come out. But the pelvis is so important and is such a big influence on childbirth, and it's such an amazing structure. So it looks like it's fixed, looks like it's like one thing, but it's not. It's different bones that are joined together with joints. Yes. So when you're pregnant, you have more hormone relaxin in your body, which can make yoga extra stretchy, let's say. But it's there because what it does, this joint at the front, especially of the pelvis, can stretch, and just that little bit extra space can help baby come through and turn and go around. So yeah, it's not the best picture of a pelvis to just chuck on top of there, but I wanted to just really bring in the pelvis as part of the physical anatomy. And now we're going to look at the muscles of the uterus. These are really important. So remember, the uterus is this big bag that goes around the baby, and it's made up of two kinds of muscles. So there's vertical muscles and there's horizontal muscles. So they do different jobs at different parts of the labor process. So the horizontal muscles of the uterus, they are like bands that go around, and they draw up during labor, and they cause the cervix to thin and dilate to open. And you can see that they're thicker and stronger nearer the cervix. And so it's this which causes contractions. It's these muscles working to open. And this here is the cervix, which is really important because that has to open before baby comes out. So before we go any further, I just want to you to indulge me in something. I'd like you to touch the end of your nose, and you feel how crunchy that is. That's how the cervix is before labor starts. And then touch your lips, and that's how soft it has to go before it can even start to dilate. So these are the two parts of the cervix. We'll come back to that in a minute, don't worry too much. And then, so the horizontal muscles of the uterus and then the vertical muscles of the uterus, they help to pull up the uterus and push the baby out. But really, the star of the show is oxytocin. Oxytocin is called the love hormone because it's the hormone that floods your system when you're in love, when you're having a romantic candlelit dinner with your beloved, when you are gazing into the eyes of your child, or even when you're stroking your pets and you feel that warm, safe, cozy feeling. That is oxytocin in your bloodstream. And to give birth, you need oxytocin to give birth vaginally, because that is what aids the contractions of the uterus. And oxytocin is a shy hormone. So it likes, think candlelight dinner, yeah? So dim lighting, safe, warm, protected, loved. And so when we're talking about birth environments, think what kind of environment is oxytocin conductive? And that's the kind of thing that you want to aim for. Okay, I'm going to very briefly talk about brainwaves and states of consciousness. I talk about this more in my book, but I wanted to just bring it in here to bring in this awareness because not everybody thinks about this stuff. I absolutely love it. So so if we took you into hospital and put some pads on your head and wired you up, we could measure right now how many hertz per minute your brain waves were going in. And I imagine that most of us here are on beta. So alert, listening, thinking, using your brain. I might be going up into gamma because I'm trying to get across a load of information to you, want to make sure that I'm using the right words, that I'm being quite clear. But some of you also might be quite relaxed, snuggled up with your duvet and just sitting back and relaxing and letting this information wash over you. So I just wanted really to normalize these states of consciousness because we travel through all of these every single day. If you don't go into these, you get ill, basically. So we need to go down into delta and theta when we sleep. And you know what it's like if you don't get a good night's sleep, or if you miss a night's sleep, you're feeling a bit groggy, it doesn't quite work. So moving through these states of consciousness is very normal, but I want to bring them into the awareness of the birth experience, because you might hear people say you cannot give birth from your mind. And what this means is that you can't give birth if your brain waves are doing this. If you are, you know, thinking, and very busy in your head, it's very difficult to get into your instinctive mind. So the instinctive mind, the mammalian mind, let's say, lives down here in alpha. And this is a state of relaxation. So this is meditation, this is deep breathing, maybe in yoga. Getting into theta consciousness when you're awake is very rare. It's a really deep state of meditation, but it happens in labor, that the laboring person will go almost into a trance state. The outside world just disappears, and they are really very deeply inside themselves and in their experience, and that is theta. And it's almost, it's a place beyond words. So there's not much language in here. So you're not thinking about what position your body needs to move into to help the baby navigate the birth canal, but you're knowing it. And this is for information purposes only. Okay. We are here. How many stages of labor? You might know this, you might not know this, you might be interested, you might not. But for information purposes, how many stages of labor? If you Googled this, you'd probably get 3. First, second, and third. So I'm just going to go through these and give you an overview. I think it's really important in birth education to know the kind of roadmap to labor. And just to be clear, in this webinar, I'm talking about physiological birth. I'm talking about hands-off, undisturbed birth. Birth can change direction at many points, but for me, it feels very important, first of all, to understand the normal. And for me, this is the normal, the undisturbed birth without medical interventions. And we will look at medical interventions briefly later. And they have their place, absolutely 100%. So much to say, but let's just get on with how many stages of labor. Okay, so in the first stage of labor, the cervix softens. Remember the cervix that was as hard as your nose, and then it goes to your lips. Okay, it also tilts forward, and then it opens. And they say opens to about 10 centimeters. Not necessarily. It opens to exactly the size of your baby's head, which is probably about 10 centimeters. But that's what happens in the first stage. The second stage, the baby moves out of the uterus and they travel down the vagina or the birth canal, whatever you want to call it, and they're born. So the second stage is pushing and birth of baby. Welcome to the world. And the third stage, which is also really important, is when the placenta detaches from the wall of the uterus and it follows that birth path that the baby has made and is born as well. So that's it. That's the 3 stages of labor. But I also like to talk about these other extra 8 stages and break down each stage of labor even further. So pre-labor, sometimes called the latent phase or false labor, which I really don't like that word, because so much is happening in the early stages of labor that you can't see because it's invisible, because it's inside your body. There's a hormonal shift. There's this cervix changing from hard nose to soft lips. These are essential steps towards active labor and birth. It's nothing false about it, but let's call it pre-labor, because it's beginning. It's the baby getting ideas. It could be it's messages from within telling you to get ready. And it could be a feeling, it could be a show, it could be the occasional contraction. So the surest sign that labour is progressing is our regular increased contractions. So the name active labour is regular contractions, and the medical model says 4 centimetres dilated. So if the midwife or your doctor came and put their hand in your vagina, they use their fingers to measure how wide your cervix is. So from 4 centimetres with regular contractions is called active labour. I also like to say that you know when someone is in active labour because they are not laughing at your jokes. Their sense of humour goes. So this is a really clear way to tell the difference between pre-labour and active labour. So in pre-labour, they having a contraction, maybe have to concentrate on it, but then in between they can make a cup of tea, they can chat about stuff, they can laugh with you, your jokes are still funny. But then when the serious business of work, of labour, and it's really good name actually, labour, because it is work. When the serious business of hard labour work starts, nothing's funny anymore. And I'd like to go back to what I said at the beginning, but this might not be true for you, that every labour is singular and unique as you are. So what might happen with you might not happen with you. So just, I'm talking broad brushstrokes here. Okay, just take a sip. The next stage is transition. When I started being a birth supporter, I didn't know about transition because I was just supporting friends and family members. But I noticed something happened really interestingly in the middle of labour. And this is often, as a birth partner, this is often where you're needed. In active labour, if someone is deep in their consciousness, deeply, down in those slow brain waves, communicating internally, maybe their eyes are closed and they're not looking for external support, in transition is when the eyes open and those words, I can't do it, I need some help, I'm stuck. There's often fears arise here because what has happened physically is that the cervix is at about 10 centimetres, which is a really vulnerable time. You are so open, you are never that open, and it can be quite scary. And there's also a change in hormones. So first, second stage of labour, so pre and active, is all about oxytocin, it's about warmth, it's about relaxation, it's about breathing, it's about finding your rhythm and your ritual to cope with these waves of contractions that are coming through you. In transition, different things change. So for those of you that live near the sea, like in Exmouth, for example, there's the ocean and there's a river that comes out. I don't know if you've seen it or if you've been there when the tide is changing. So the tide comes in and the river kind of stops a bit. And then there comes a moment when the tide starts to go out and the river starts to come back and it's all like a bit choppy and they don't know which direction they're going. They've kind of lost their flow. For me, that is a really good explanation of what transition is. The two tides have met and it's all a bit choppy for a moment because what has happened is some adrenaline has come into the system. Because remember those muscles that we looked at back on the anatomy? So the round ones that have been opening up the cervix, but now they've done their job. The cervix is nice and open. It's not actually that big. Cervix is nice and open. Now these other set of muscles need to come in and the baby's being pushed down and out. So often the position needs to change. Maybe the birthing person will get up and lean forward a bit more and use a bit more gravity. Quite often in transition, they want some reassurance. They want some real good space holding. They want to know that they're okay, that everything's good, that you've got them, that they're safe, and that yes, they can give birth. So this is a time to really, as a birth partner, to really hold strong, look them deep in the eyes and say, you've got this. It can be useful to have a code word. So this is a word that would be used in an emergency. For example, if you were planning a physiological birth with no artificial pain relief and you wanted to be encouraged and supported, but there might come a time when you've reached the end of your inner resources and you really need extra help. Having a code word that means, I don't want you to reassure me anymore, I want you to give me what I ask for. So we've got through transition. It's been soothed. She's refound her groove, doing well. Welcome to rest and be thankful. All of these stages, you know, there's not road marks on these, not, you know, signs on these. You might not get to any of them. You might just go through them in a blur and not realize. Rest and be thankful might come, but might not. It is when contractions slow or stop, and it could be for 20 minutes, 10 minutes, 5, but it's a really quiet, restful place when it happens. So you might have been labouring for hours by now and you've gone through this kind of choppy transition, and then rest and be thankful comes, and maybe it's time for a little snooze, something to eat, a drink, and let's just rest. We've got to the peak of the mountain, let's say. We've climbed up, we've gone really high. The cervix is open. There's nothing stopping now. And that's before we come down the other side of the mountain and we move into the pushing stage. And this is the change of muscles. This is, baby is starting to come down. The head comes out of the uterus. It moves down into the birth canal, into the vagina, navigates that turn through the pelvis. They present a part of their body, most often the crown of the head, but sometimes a different part of their body, like a bottom or a foot, very occasionally a face, will present out through the vulva. What will happen, baby will come down, they will stretch that muscles, and then they will go back in. So if you look at your vulva now, if you get a mirror and look at it, you'll see it's like full of folds. So what they are for is that when the baby's head is coming through, they stretch out big and beautiful. And that, I kind of think that's why they're there, so that they can stretch. It's a concertina. But what often happens is the baby comes down, they stretch a little bit, they go back in, they stretch a little bit, and that might happen for, I don't know, 3 or 4 contractions. And you think, why are they going back in again? But they're stretching, they're stretching, they're stretching, and then eventually they will come out, let's say, and their head will be born down to their neck. And then they turn, because they have to navigate through the pelvis, and then one shoulder comes, other shoulder comes, and then baby is born. Congratulations. But birth isn't over yet. This is stage 6, let's say, if we're putting numbers on them. The next stage is really important, the golden hour. So don't start making loads of phone calls. Don't turn on all the lights and start asking loads of questions. This is an hour to be treasured. It is precious. It's a time of massive changes in baby. They begin to breathe. They come out into the air for the first time. Their neonatal circulation starts. They stop using their umbilical cord, although really don't worry, in the first few moments after birth, babies can look a bit of a funny colour, like bluish, because they only come with 2/3 of their blood. Another third is still in the placenta, so it will keep pulsing, the cord will keep pulsing that blood to them until they have all of their blood and they've pinked up. And it's also a time for falling in love. There's a massive oxytocin rush. So we had oxytocin in the first stage. Second stage, we had a bit more adrenaline and movement and action of bearing down. And then third stage, the golden hour, we're back to oxytocin. This is about gazing into each other's eyes, touching, smelling, getting to know each other, your baby comes out hardwired to fall in love with you. They recognize your voice. They will turn their head to your voice. They come out with all of their capacities of their body to bond with you. Their vision is about this from the arm to the face, and what they did some tests, and what babies really like to look at is 2 eyes, nose, mouth in this configuration. They find it fascinating because they are hardwired to look at you. So that first hour, however long labours has been, an uninterrupted physiological birth, babies will most often be born wide awake and ready to hold on to you, look at you, maybe to have their first feed, to suckle the breast. And what also happens with the breast suckling is that it causes the uterus to contract again, and then that clamps down and the placenta will detach and come out through the vagina and be born. And with the birth of the placenta, that marks the end of the birth process. But how many stages of labour? Forget everything you just heard. How many bends on this road to meet the mountain? I don't know. What town is around the corner? I don't know. I've looked at the map. I have an idea. So the idea behind this photo is that birth, physiological birth, follows this archetypal journey, the one that we just looked at. But we don't know what's around the corner, so we just have to trust the path and what is responsive, and be responsive to what happens in the moment. This means being fully present each moment to moment with our eye on the top of the mountain, on that destination of where we're going. Because birth is not just a biological event, it's a spiritual rite of passage, and whatever happens, you will be forever changed. You will always remember what happens in your birth experience and how you were treated. So it's really important, birth partners, be there, be present, listen, be attentive. Take each curve in the road as it happens. And knowing the birth stages gives you a rough idea of what's coming and what to expect, but it's not a dictation. Okay, so moving on, causes of pain in childbirth. So I wanted to make a clear differentiation between sensations, pain, and suffering, because they're 3 very different things that happen in childbirth. So there are a lot of strong sensations associated with labour. There, as we've talked about, there are the uterus muscles contracting, muscles that have never worked before in this way. There is the weight of the pressure of weight of the baby's head on the uterus and on the cervix. This lack of oxygen to muscles. Stretching, for those of you who do yoga, you think about that feeling when you're in a deep stretch. That's what's happening deep inside your uterus and the vaginal walls. They are being stretched, and so these very intense sensations are happening. There can also be tiredness. Labour can go on for a long time and still be very normal, but the tiredness is a strong sensation, and the intensity of emotion, all of the preparation, and all of those things that we've looked at, your historical, your society, your spiritual, your emotional, your instinctive, your physical, all of those things coming together. It's a strong sensations, let's say. But pain is something else. And one of the explanations of pain is this triangle. So fear causes tension, tension causes pain. So we have these brains inside our heads that are very, very slow to evolve. So the industrial society is really a blink in the eye of the timeline of the human race, just a few hundred years really. But we were tens of thousands of years in the Stone Age in caves. And so when we're born, or the hard wiredness basically in our brains is Stone Age. And we don't have the same kind of risks or things that were dangerous to us in the Stone Age, but we still have this fear response. So we might not encounter tigers when we're in labor, which would mean that labor would stop, the muscles would close, all the blood would go to our arms and our legs so that we could run away, we'd get lots of tension. We don't have those tigers anymore, but we might, if someone comes in that we're not sure about, we're not liking, it can still trigger a fight, flight or freeze response activations, which means that oxygenated blood will be taken away from the uterus, and it will go to other organs, other muscles, and that will create tension in the body, which increases the pain. So that sensation of the uterine muscles contracting can turn into pain if you're tense, which is why we talked about how in the first stage of labor, how important relaxation was and breathing. So breathing is not just this kind of airy-fairy thing. On a biological level, breathing brings in oxygen to our lungs, which then gets taken by our blood and goes round to our body. If we don't have enough oxygen in our body, there can be lactic acid buildup in our muscles, because that blood that pumps around also takes away waste materials. So a flight, fright, freeze response can also include stress hormones. We're afraid, we get kicked with those stress hormones and adrenaline instead of oxytocin, because we can't have both. We can't feel warm and safe and loved and scared at the same time. Muscles become oxygen deprived, lactic acid builds up. There's a uterine muscle complex. So this is when the muscles around the neck of the uterus can close, but other muscles are still pushing the baby down. So baby can't get out. So they're just pushing and pushing, and that is painful. And then pain turns into suffering. Nobody wants anybody to suffering. Childbirth is not a competition. Giving birth without pain intervention is not a benchmark. It's not a goal that you need to suffer through to get there. Suffering is different to pain. Suffering is distressing, and it can potentially be traumatic. And that is a line that nobody wants to cross. Okay, this, how to increase labour pain, is a little bit tongue-in-cheek, it's a little bit fun, but it's how to make a really painful labour. Pent up. Even if you're really tense, you'll have loads more pain. Pay lots of attention to every contraction right from the beginning. This will waste energy. Do not sleep or rest. Staying continually active is exhausting. Do not eat or drink. This will also wear you out as you dehydrate and starve. Do not use the toilet. Remember the anatomy picture at the beginning with the bladder and the colon? Well, if they're both full, they act as a physical barrier, and the baby will have trouble getting out because they can't get past those blockages. If you want to increase labour pain, worry a lot about how you look, how you sound, how you perform, because being self-consciously aware of other people's opinion is a really great way to slow labour down. Do not make any sounds or do anything strange. What would people think? Lie on your back. Gravity will make it harder for your uterine muscles to push baby down and out. So obviously, this is all very tongue-in-cheek because we do not want you to increase your labour pain. So do the opposite of these ones. Relax. Try not to pay attention to your contractions from the beginning. Let them build, let them start. Sleep, rest as much as possible. Eat and drink. Eat to hunger and drink often. use the toilet at least every hour. Don't think about other people, just get on with what you're doing. Sounds are really good. Mooing and grunting. There's a link between the vagina and the muscles on the jaw. Some people do their horsey lips to make a really loose jaw. Lying on your back. When birthing women are left undisturbed, they often end up on their knees leaning forward. I see that as like the most instinctive, but also lying on your side. If you're tired, lying on your side is better than lying on your back. But thinking about that pelvis and the anatomy and how baby has to go around a corner. If you're lying on the back, they have to go upwards. So how not to increase labour pain. And now a breath break. Take a deep breath. Maybe close your eyes a little bit. Just come away from the screen. We've been doing a lot of thinking, a lot of talking, a lot of information. Take some couple of deep breaths. Feel your feet on the floor. Feel the weight of your body in the chair or the sofa, wherever you're lying. And just let yourself relax into that. Maybe look at the picture of the sunset, allowing yourself to expand, relax, and just breathe in this moment. You'll often hear people talking about breathing in labour. And we've talked about how breath can bring oxygen on a biological level. But also there is a mind-body connection and a body-mind connection. And it's a two-way flow that can control you or be controlled. So if your body is stressed, you might find yourself, your heart beating, your breath being really shallow and rapid. You know, that flight, fright, freeze response, ready to run away. But if you are really relaxed, how's your breath? How are you breathing when you're lying down just before going to sleep? It's normally quite regular, quite deep. So we can fool our minds into relaxing by breathing really slowly and really deeply. So our mind can affect our body. And this is really important for birth partners as well to know, because these hormones are infectious. So if you are emanating and feeling oxytocin, this will help your partner to feel oxytocin. So that's you as a birth partner using your breath to calm yourself down, to calm them down. Probably the worst thing you can do is shout at them, calm down, because that's not going to calm anybody. You need to model it, you need to role model that calmness, that relaxation, and using the breath as an anchor is really powerful. I think it's really powerful to watch positive births, because what often happens in our society, really normally but very strangely, is that when we give birth, it's often the first time we've actually seen a birth real. And for some people, when they hold their baby, it's the first time they've ever held a baby or changed a nappy. So we live in such a different society now. So we are not exposed to birth in the same way that our grandparents might be. So I want to look at birth options here in Exeter, in Devon. Remember your brain as we're going through. So I am just going to share some of the things that you have options about, and then you can do your research, talk to your midwife, talk to other organisations, and make up the choice that's best for you and your situation. So first question that people often ask is, where are you going to give birth? What is your plan? So legally in this country, you are allowed to give birth wherever you want. You give birth in your garden, in a field, wherever. But generally, people give birth at home, in the birth centre, which is midwife-led, or the labour ward. And so the birth centre and labour ward are both in the hospital on different sides of the corridor, and the theatre is as well. Most theatre is where you go if you're having a caesarean birth. The birth centre is midwife-led, and the labour ward has more doctors, so you can have more kinds of intervention there. And yeah, this depends on you and your situation, your choice. So who is going to be there? Are you going to have your partner? Sometimes people's partners make great birth partners, and sometimes you may decide they're not the best person to have in that room. Remember how their hormones are infectious. So if someone is very anxious, then maybe they would be better at home, preparing the space to welcome them back, and maybe you'd like somebody else to be there, your mom or a friend or a doula, whoever. You might also have a midwife, and you might have an obstetrician if you're having a medically managed birth. So I know throughout all of this webinar that we've talked about a physiological birth as normal. So here, I'm just saying everything, because these are your options. So what kind of birth? So physiological is this. It's what we just saw in that birth video. That was a very hands-off birth video, but physiological means no medical management, and obviously a caesarean is a different thing. Oxytocin. If you are going to give birth vaginally, not a caesarean, you need oxytocin to do that. It can be natural or it can be synthetic. If you have synthetic oxytocin, that blocks the beta endorphins, which are your body's natural pain blockers. So what can happen if you have synthetic oxytocin, so this is through an induction, or if your labour slows and they want to give you an oxytocin drip, is that it can mean that you need some artificial pain relief to support that. Whereas natural oxytocin, which is what your body produces, comes with better endorphins. I'm really just touching very lightly on some massive topics here. You could go to a whole webinar or on oxytocin. So yeah, this is really just a taste. I'm whizzing through this stuff. Pain relief options are huge. Basically, the ones I've gotten here are from low intervention to very high intervention. So beginning with relaxation and breathing, hypnobirthing, active birth, which means moving around, a TENS machine, which is trans-electrical nerve stimulation. It's a little battery-powered box and some sticky pads that go on your back and help with nerve stimulation when you're having a contraction. Some people find it's a good distraction. A birth pool is a good pain relief if that's an option. If you're having at home, lots of people do that. And there's also pools in the birth centre, and there's one in the labour ward in Exeter. Gas and air or Etanox. Opioid, some people have an injection or they have a drip, and epidural, which is numbing from your waist down. Oh, sorry, just going back to the pain relief things, remember your brain is most important for the pain relief section, especially if you're going up to the higher end. No judgment if you need any of those things, they're there, but they have benefits and risks on all of them. So if that's important to you, you can find out more about that. Cervical examinations, this is when a midwife or a doctor put their fingers inside your vagina, as I said earlier, and they measure with their fingers how many centimetres dilated your cervix is. Their standard is that they offer them to you at regular intervals so they can measure how labour is progressing, but this is an option, so you can have none. You can say no, or you can have them when you want them. Again, this is something to discuss with your midwife and do some research about, because there's a wide range of opinions about this. Delivery, so how the baby actually comes out. hands-off, like in the video we just watched. Assisted instrumental delivery is when they use use an instrument to help get the baby out of that canal. Sometimes, you remember on the anatomy picture, they have to go around that corner. Sometimes they need a little bit of help to get around. Hands off, our cesarean. Who's going to catch the baby? Maternity staff, mum, birth partner. Something to think about. What's going to happen straight after birth? Generally, these days, first thing is skin to skin, but some people, it used to be more common, and now if you request it, the baby can be wiped down and wrapped before giving to you. Sex announcement should have its own star, really, because if you haven't found out the sex of your baby when you're pregnant, who would you like to announce it? Mum, birth partner, maternity staff. It can be a moment, and that's your choice. You can write that down in your notes. How would you like the third stage to go? Physiological is hands off. So within half an hour, generally, if there's a lovely golden stage, the placenta will detach from the uterus and be born. You can have it actively managed, which is they offer you an injection and they give it to you in your thigh, I think, and then it happens much quicker. Feeding. How are you going to feed the baby? Are you going to offer them breast milk, or a bottle, or a spoon, or syringe with formula, or human milk, which can be there's human milk banks around the country. Something to think about. The placenta, what are you going to do with it? Some people like to look at the placenta, and midwives often really enjoy showing you where the umbilical cord was connected, what side the baby was on, what side was attached to the uterus. Some parents like to keep the placenta and maybe bury it in the garden under a tree, or some people turn them into placenta encapsulation and take them as medicine, and some people don't want to look at it or see it, and the midwives take it away. And finally on this list is vitamin K, which is suggested for newborns because they come out with very low vitamin K, which is vitamin that helps with blood clotting. So regularly you will be offered an injection in the baby's thigh. If you don't like that, it can be taken orally right after birth, and then a week later, and then I think a month later. These are options. Remember your brain when you're thinking about them. Okay, we have just a couple of slides left and then we're done. And I wanted to have a look at how to have a positive birth experience. I think you're going to recognize this. Yep, so we've come right back to the beginning of how we started this evening. So how to have a positive birth experience, I think, is not about the last slide. It's not about who or what or where you have your baby. It is about how you feel. And one thing I didn't mention in your birth plan is, for me, it feels really important when you're planning your birth, not just to plan the kind of form, like who, what, where, but to plan how you'd like to feel and how you'd like your baby to be welcomed into this world. And this feeling, this essence of the birth plan can be taken anywhere. So whatever happens, because as we talked about earlier, the birth path can have many forks in the road that we can't know in advance. Remember this mystery, so we leave space for the unexpected. So if you're having a home birth and you have to transfer into the hospital, and so that means all of your where and who and where goes. You don't have to give away your whole birth plan. You could write a second birth plan and still have birth preferences in the hospital, but also this essence. So some people, they might like to feel loved and warm, or for other people it might be you want to feel informed or in control of decisions. And so making sure that that is really well communicated by your birth partner and understood by your caring staff and maternity staff. So when people who were interviewed looked back and who had had a positive birth experience, it wasn't about what kind of birth they had or how many pain relief they had. It was how they felt. during labour and birth. So I think to help prepare for that, it is really interesting to come back to this pie chart. And so you see each part of the pie has got different percentages. And they will be individual to you and your situation. So you might know loads about the physical part of birth. You might have already started your pregnancy yoga class, and you might be doing optimal fetal positioning to help baby get into a good position for birth. But you might not have thought about your own birth experience. You might not have asked your parents about how you were born yet. So this historical slice might be really small. So when you're looking at this list, if there's something on there that really draws you and you're like, oh, I've never thought about the mammalian brain and my body's instinctive wisdom, and that calls you in, I invite you to take that away from this webinar and go and do some research and find out more and lean into that. Equally, if there's something in this pie chart that just repels you and you're like, I don't want to think about it as a rite of passage. I want to be a maiden all my life. I'm not ready to move into the mother archetype. Just gently lean into that and see what you're afraid of. The thing with labour is that it's such an intense experience that fears that you might be able to suppress in your day-to-day life come up. And so as much work as you can do now in pregnancy, especially if there's any previous trauma or fears or high stress levels, I really, really recommend that you work with them now and learn how to relax and practice relaxation on a daily level, if possible with your partner as well. Relaxation is a learned technique, and the more that you do it, the more well-worn that neural pathway will be in your brain. When labour starts and you go, right, okay, now we're going to relax, you know, in your sitting, in your breathing, in your whatever practice it is that you found, your body and your mind will be much better accustomed to walk that path. So yeah, how to have a positive birth experience. There's one other thing. We live in for some of us, quite a lonely society. A lot of us live away from family and friends. We live away from family, but maybe with our friends or with our neighbours. We often move around for work and we don't have a community. And we, you know, are you pregnant with friends or do you know other people? So let me see what I'm leading on to. I'm leading on to Nesters. So this is a weekly pregnancy group that the Nest runs in Exeter. We meet at the moment online once every 2 weeks and in person at the Beacon Community Centre once every 2 weeks. And this is a really warm, welcoming community. It's a village of pregnant people and we get together, drink tea, chat, and realise that you're not alone. You're not the only one going through this experience, and a lot of little niggly questions or worries that pregnant people find that they have, they realise that they're not alone in these little things, and that having this designated space once a week to talk about pregnancy and things that are happening is really, really supportive and helps also with that transition. So it's a pregnancy group, but it also goes over into postpartum. So people come back for the first 6 weeks or so with their little baby, and then we have a follow-on group. And so, yeah, that is Nesters. Find a community to be a part of. And that is my final slide. This here is my book, A Birth Path, Stages and States of Consciousness by Hazel Tree. You can find it on Amazon, which is a bit about some of the stuff we've touched on this evening. It's a booklet rather than a book. And this is a picture because it's cute. Here's my email if you want to email me about anything. This is my own website and this is the Nest website. If you go onto the Nest website and you click on pregnancy and birth, and then scroll down that page, you'll come to a list of resources. So if there's, if you want resources like for books or websites, so lots of stuff that we've covered in tonight's webinar, you will find there on the Nest. And so that's it for now. I'm going to turn off the recording and open the space for Q&A for the people that are here live. And that's it. Thank you so much for your attention. Thank you so much for listening. And I wish you a really positive birth experience.